Hey fielders, I'm live here to answer any questions you guys might have. I know things are crazy today, same here. I've had about five different visits canceled, so let me know if you guys have any questions as we go live in the field guide. So I'm here. Hey Sarah, hey Jennifer, Ed. Ed's in the group. Good to see you, Ed. Courtney, good to see you. Any questions you guys have? I mean, I think with what's going on out there, who knows what kind of questions we're going to get today, but here to help with whatever I can. You guys throw questions that you have out there, post them in the comment section down here, and I'll be happy to answer anything that I can. I know this is an ongoing thing. Hey, Becky, how are you? So I want to see what's going on out there with you guys. Each state is different, and it's driving me nuts because I think this should be a federal situation where they tell you from the federal guidelines what you should be doing for your practice. I know everybody should make their own decision, but it's getting a little crazy out there. So anything you guys have questions about, throw them at me. Becky, what are you seeing with your clients? Rick, what are you seeing with your clients? Throw it out there in the comment section so people can see it. I know I haven't worked in a practice where the situation has been similar, but I'm just going back to 9/11 and what we did during those periods of time and how we changed some things. I know a lot of places like Alabama haven't had many instances. Let's see, we're in Florida and we're open. Are most offices open to your knowledge? Most offices are open. Is that the right thing to do? I don't know. If you look at some of the statistics that said that dentist, hygienist, assistants are probably the most prone to getting a airborne virus, I don't know if this is the right thing to do. So, but it is what it is. I mean, and I'm not an expert on this stuff, but the one thing I will tell you is I think that this will implement some big changes coming down the pike as how we set up practices and how we protect ourselves, especially when I look at some of the federally qualified healthcare centers I work with, as opposed to general practices that I work with, how they actually utilize protective health, protection equipment. All the federally qualified health centers I work with use a full face mask as opposed to, I'm talking about a shield, as opposed to just a mask when they're treated patients. So I think, good or bad, I think this outbreak will actually change some of the ways that we do things in practices. Yeah. And even with, sorry to say it, as much as I'm on a plane, the way that I interact with people too. So, let's see. Most patients are coming in to their appointments. Yeah, patients are coming in. People are going about their normal routines. Just in my own life, I went to my normal Saturday morning breakfast, like I do every single week. The tables were a little further apart, but it was what it was. So not sure what's happening with everybody. Hi from Nebraska. How are things in Nebraska? I know where you guys are. Been to your practice, Jeannie. So Janice, I know what it's like. You're a little further from the mainstream. So how are things there? Dana, how's things in Tennessee? We're open, business as usual. Patients are calm and healthy. We were screening for temps. Yeah. I think the perfect example, and I'm not a sports person, but I think the guy from the Utah Jazz who was on the news this morning is tested positive, has absolutely no outward signs, not even a temperature. And he is positive for coronavirus. So not sure what's going on. But you guys let me know what you're doing in your offices. It's very interesting to see. Let's see. I have a pedo office in New York. They're currently seeing patients. The front office is meeting patients at the door. Yeah, and I think that when I saw a lot of the protocols that people were putting in place with having patients wait in the car and then come in, I think great idea. But what's going on is just, I think this is unprecedented. I think that it's great if some of the offices have these policies, but who knows what's going to happen long term. Bet, good to see you in here. Yeah, you're right. This is a great time to update the practices. I think this, this is what I used to call admin time when we used to shut down the practice. You know, I saw somebody went to Home Depot and bought some pretty much Cavicide and a spreader like you would use to put down a what do you call it, Weedex kind of stuff, and really cleaned the office and did a whole lot of preparation for going forward. And I'm glad this opportunity to do some WebEx, Facebook Live to go into the offices. Iowa open for business. Patients still coming. Doctors decided what she's going to do. Yeah, I think this is a minute by minute thing. I think what's happening is we're looking at things and deciding what we're going to do. Dawn, hey Dawn, good to see you. Let's see, we're open and patients are coming in, only had a few cancel. I think those who are canceling, they're going to cancel. There's nothing you can do about it. I think as long as you guys know, and I don't know if you noticed, Elizabeth posted in where I said I was going to go live about what to do about the schedule and how to figure out if you are moving patients. There's some great tools if you have to close a day. There's some great tools to be able to move patients from one day to another in bulk, so there's some options that we can show to move patients within the schedule. And this is going to be, I'm hoping, and the reason I decided to do this, I hope that you guys aren't overwhelming the PTC with questions that are questions that we might be able to solve here as a group, so we can answer one question and lots of people get the answers instead of having 100 people call the PTC with the same question. So we are open, doing patient temperature screenings on everybody and come to the front. Yeah, sanitizing waiting room every hour. That's a great idea. My big concern is I go into thousands of practices and I see the way that people will spray a chair, wipe it down, and have another patient sit in that chair in 2 to 3 minutes, or not even at in 30 seconds. And we all know that that's not proper cleaning of the chair. So, and who knows? And again, not an expert, don't know everything there is to know about this stuff, but wiping down a chair and spraying it with Cavicide, yeah, that's the way to do it. But how long is this thing supposed to stay on surfaces and all that? Who knows? I don't know. And remember, I'm trying to help you with the Eaglesoft, so I don't know. We're having a meeting today, how to proceed with the office, still under construction. Yeah, I know. It's crazy. This is the biggest thing, and one thing I will tell you is for the people who work for me and some of the offices that I work with, trying to make decisions about where we go with hourly employees, and kind of like what Bet said earlier, this is an awesome time to come up with disaster plans, to come up with employee manuals. Rick, who is in the group, is a great resource for some of the things that we need to do in order to retool. So when this happens, we're prepared. Rosie said we are closing for the month, seeing emergencies only. In a lot of states, that was the recommendation from the state. In Pennsylvania, where I am, the governor's kind of requested that those kind of things happen. We're in New York, and we've had a lot of cancellation. Governor has shut down bars, restaurants, schools, gyms. Somebody made a comment on Facebook earlier that that this is like the Titanic sinking, and dentistry are the musicians who are still playing along. Bad analogy. The people who were playing on the Titanic were playing to keep people calm. I don't think that's what we're doing in dentistry. I think we're trying to hold out because we are, for the most part, hourly employees. I have a big sign in my office. It's up there, so you can't see it, but it says when our chairs are empty, we're unemployed. So for the most part, if we're not able to keep patient flow, we're hurting as a business. So it's a big difference between playing the instruments on the Titanic. And I wanted to respond, but I don't get into a lot of crap on Facebook if I can. So we are in New York. Yeah, I saw that one. Okay. General practice in Florida. Our schedule is starting to fall apart. May move to emergencies only. Yeah. And the problem is, what's an emergency? Is the final cementation of a crown an emergency, especially if we're going to be out 3 weeks or 4 weeks or whatever might happen. So yeah, there's some things that need to be done and some things that need to be finished up. So emergency care only. What's an emergency? Who knows? All right. So we were meeting patients at the car, screening their temperature taken. schedule is falling apart, worried about staff being paid. I'm with you, Lindsay. I think that's exactly where we are, and that's in North Carolina. I have a plan to actually be in North Carolina next week. Working with an office actually in South Carolina, but it's cheaper to fly into Charlotte at the moment. So I'll be flying into North Carolina next week, unless something changes. So we'll see. I'm hearing a lot from my offices I work with in North and South Carolina. Would you recommend it updating to Windows 10 Eaglesoft 21 during this period? I would. The only issue with upgrading at this time is if you need the assistance of your IT people, and if those IT people are short-staffed, you don't know what might happen. Upgrading during the period of time and needing the assistance of the PTC. Right now, the PTC, from what I understand, is at full capacity. I mean, everybody's working, not a problem. But you might have IT people who are not working. Revenue Well just went through a changeover where they're moving some of their people home to work from home today, and they've had a little hiccup with that process this morning. So I wouldn't do much of anything right now other than to work on existing issues and dig deeper into what you guys already do. But to make big changes, updates, especially Windows 10 Eaglesoft 21, if you don't know what you're doing and you're not prepared for that change, not the time to do it right the moment. So Kim, good to see you. Denise, Virginia here and open for business, screening all patients, sanitizing and removing all magazines from the waiting room. That is one of the biggest things I saw that I was like applauding people from doing, getting rid of the toys, getting rid of the magazines, those things from the reception area. Great idea, but I applaud you on that one. Anna, I heard on NPR today, doctors say that if we feel we are overreacting, then we're meeting this challenge correctly. It's the common feeling that dental office will be closed within the next 2 days for possible. Yes, I agree with you. And I think, when I started, I have a big seminar scheduled for Friday in Chicago that was canceled up until about 4 o'clock this morning when I typically get up to go to my desk. I was ready to go to Chicago and present for 300 plus people. I changed my mind at about 4 o'clock this morning and said it's probably better not to go do a seminar like that. And luckily, or not luckily, but when I got up this morning, I had a message that the seminar was postponed. And I think that errs to the side of caution. I think that's the way we're going to have to be for the next couple of weeks. And using that term, flatten the curve, I think that's the way. Diana from PTC, there you go. We're open and ready to take your questions. See that? Before I even knew it, I figured that was going to happen. Yeah, so PTC is at full strength. And if you need them, call them. But like I said, I think they're going to get 1 million calls for little questions. So if we can answer one question here that takes 4 phone calls off of PTC, I think that's a great idea. Hey, Jane, how are you? Good to see you here. Let's see who else is in the group. Miguel, Fran, all my good friends. I love when I see people in here that are people who I know in real life. So, and Jane is one of the best members of the group because she's one of the only people other than me who's been to all of, and Alex Nudell, who've been to every single one of the Eaglesoft Live big one events. So good to see you there, Jane. Hopefully everything's going well with the practice. I'm fielding questions from 4 different places here. Somebody texted me a question a couple minutes ago. Let me see what that was. Oh, cool. All right, so I'm going to do that. So PTC asked me to do something. I'm going to put a poll up in the group as we speak. So if you guys can do me a big favor, if you're in the chat, you can also, hopefully you can open up another window. And I'm going to set up a poll that just says, who is open? Didn't go to the right place. Sorry, guys. Give me a second to type this up. Quick question. Oof. This chat's making my computer run slow, so poll. Yes. No. Now. Okay. So I put a poll up there that just says, are you open, closed, or deciding now which way to go? Don't need any commentary, just yes or no. And now that poll is live. Diana, you got it. I posted it for you. Hi, Elizabeth. I want to come see your baby. Forget this travel stuff, but I guess I'll wait. Olivia, I still plan on coming west to see you guys. Geez, Seattle is getting hit like crazy, but I'm still you're on my calendar to come unless something changes. And Maryland, I was driving through Maryland on Friday. I did do a presentation in Baltimore on Friday. We had about 15 people there. And it was kind of under the level of 50 people to come to a conference. We had, like I said, just under 15 people. But again, caution, it's a good idea that maybe we shouldn't be doing these events until we cleared some things up. Andy, stop being online, get out there and get our money back from these deadbeat people. Great to see you, Andy. And Marianne, you said yes to which? Are you open, closed? Is that what it was? But I put a poll over there in the group. So hopefully everybody can go over there to click on if you're open or closed during this event. And if you are deciding to close, let me know. So far, 8, 9, 10, 11 people said yes. Nobody said no yet. We'll see what happens. Most of the offices I've talked to are open, and I guess I should have said, maybe I'll do another poll later on today that says, are you open, closed, I'm sorry, open seeing patients, open working administratively, or closed. And then we can also, I'll tweak that poll in a little while, but I think it'll be a great idea. Okay, Mary. Yeah, so yes, open in Maryland. Okay, good. And hopefully you clicked in over on the poll to show those numbers over there. Any questions that I might be able to help with what's going on? One of the things before this got as big as it did, one of the things that I suggested to a couple of people who I work with one-on-one was to add a line item in your confirmation, if you can, based on what system you use for confirmation. The same things people are putting signs up for in their reception areas. I think it's kind of late if you've asked somebody, in the reception area, if they've traveled recently to northern Italy or China, if they have a high fever or whatever. If they're already there, it's kind of too late. So I think if you can put some of that verbiage into your confirmation messages, that would be a big difference. So think about that and look at how many characters you can add to your confirmation message to get that information out there. Let's see, Elizabeth, the results may be a little skewed because people who are currently open are likely to be watching the live chat about Eaglesoft. Just saying. You are right. You are right. So that's why I'm going to tweak that poll a little later on to say, open and working administratively, open expecting patients to show up, but they're not. So there's a whole lot of nuances to just saying, are you open or closed? But that's what happens when you're rushing like I'm doing. So a couple things that I'm running into, and like I said, the news reports are scary. But the one thing that I wish people would realize is the people who are recovering from being tested positive, and those people who have show no symptoms. Like, and again, I'm not a sports person, so the first example I gave was the guy who is, I think, on the Utah Jazz, who is tested positive but has absolutely no signs, symptoms, no fever, no symptoms at home. His comment this morning was, if he had to go out and play another 7 series of games, he could do it today. So, yes, I appreciate the fact that people are taking temperatures, but that doesn't mean that they have it. It's very much like I'm old enough to remember the early 80s and testing for HIV. There were a lot of false positives, a lot of false negatives. So just because you get a temperature test doesn't mean anything. I know somebody who's recently back from Italy, and from northern Italy, from the hot zone. And he came back right before it really blew up, and did not test positive. But if the incubation period is whatever they say it is, he has self-quarantined, and he's a very conscientious person. So he did quarantine himself, but it's quite possible that he could be a carrier, and he hasn't been tested, and can't be tested, or nobody will test him at the moment. So, who knows? But any other questions that you guys have about what's happening? I think Sarah's question about, is this a good time to do the upgrades for Eaglesoft? Yes and no. Check with your IT company to make sure that they're going to be around. I'm a big proponent of, if you're going to do an upgrade to Windows 10, Eaglesoft 21, you need to be working with an IT company who has done this, not just your brother-in-law down the street. We all know computers, but I have so many people who they say they did the upgrade to Windows 10, Eaglesoft 21, and they did it on a computer that was originally Windows XP, and they're basically trying to put a turbocharger in a Model T. That's not the way you do an upgrade. So just be aware those things should be done with some help from a professional. So there you go. Oh, good. I see Mary May added something to a conversation I was having earlier with Elizabeth about what do you do about moving patients on your schedule. And she suggested if you move them to the third column, then those patients will not get contacted. That's a setting in RevenueWell. You have to tell them, you have to go in your settings for RevenueWell to say that don't contact people who are in that column. Just doesn't mean just move everybody to that column and they automatically don't get confirmations. So and Kate posted, yep, she's right. Same thing I just said. You have to make sure that you set it up in RevenueWell that way. So there you go. Barb, you guys are closed in Michigan. I've been to your office. So is that a mandate from Michigan, or is that a choice that the office made? Because I've been trying to watch all the states' notifications to see what was happening in each state. Is this a mandated thing, or is this something that the office chose to do? So I see closed in Michigan, and are you closed today? Is that closed for a period of time, or is it choice, or is it mandated by the state? So, Sarah, recent question from customer: is there an e-scribe program that integrates with Eaglesoft? A doctor found one that is not integrated, but only $10 a month. What integration service would you recommend? Good question. I recommend the one that you like, because I tested a couple of them, one of which was so convoluted that the doctor who started using it wound up prescribing amoxicillin oral suspension over and over again before he realized he wasn't prescribing the right thing. Some of them were really convoluted. Some of them, and as far as integration, I don't know that any of them truly integrate. They are bridged so that it may pull information out of Eaglesoft into the other software. Would I recommend any of them? No. If I can get one for $10, I'd use it. If I could get one for, when it comes to things like that, I go cheap. And that's what I think a lot of people hear me talking about all the time when it comes to e-claims. So Renaissance Remote Light, yeah, go for it. It's cheap. It's easy. Is it the best? No. Would I use it in a small practice where I'm not submitting a lot of claims? Absolutely not, because I'd want to, I like the integration with Eaglesoft. But would I use it? Like for my office, it's 26 operators. Heck yeah. I would definitely use it. So it's a situational answer. But when it comes to eScribe, I go cheap because I want to use whichever one is the cheapest and easiest to use at the moment. So Susan said that in Maryland, they are open. many cancellations. Susan, where are you in Maryland? Are you closer to DC? Give me an idea. Annapolis, you are Ocean City, Maryland. So give me an idea where you are in Maryland. And is that, again, question, is it mandated by the state of Maryland, or is it a choice that you guys made? And are you taking it day by day, or do you have a plan for being closed for a period of time? We have, okay, so Barb from Michigan. All right, so confirmed cases in their county started with closed for the week. The schools are closed, churches, bars, et cetera, et cetera. Yep. It's interesting. I go to a really big church, and they canceled church this weekend. But we'll see what happens there. It's a shame that when churches are closed, it's sad. Rosie says we are actually closed this week, but we're actually open this week, but closing Monday, meaning I guess today. The schedule is getting lighter by the minute. Still waiting for guidance from MDA, Michigan Dental Association, and the ADA. Yeah, I mean, this is something that I wish the ADA would just say, hey, this is what you should do. Closer to Baltimore. Okay, good. Yeah, so, yep, Ellicott City. I know the area very well. Let's see what else we got here. And I'm looking, like I said, I'm fielding all my social media here to see what questions come in at any point. And let's just see. So guys, if you have questions, post them there. And a lot of what I'm saying, with when it comes to what you do with your practice is the answers I'm giving are my opinion. And as I typically type in my never to be humble opinion, because I'm not a humble person, but there it is. Yeah, we had live worship. Yeah, and and that's one of the first things I said for those people who are just getting into this. I think one of the one great thing that we're going to learn from this, and I learn so that I can teach. I mean, that's kind of my motto. I think one of the great things that will come out of this is we're going to find out that we have opportunities to work from home. One of the offices I work with, the office manager has about an hour commute on some pretty heavily trafficked roads. And anybody who knows my backstory, the reason I got into consulting is because I had a car wreck. So I think we will learn from this that there are opportunities to work from home in a lot of situations. We're going to learn that teledentistry, which I'm not a huge fan of from the billing standpoint, but I think we're going to find some opportunities for those things to work in our practices. I think we're going to find some better ways of maintaining and cleaning practices. I've visited practices where I wanted a hazmat suit on as I walked in and out of the practice. I can't believe some of the practices I've gone in and how dirty some of them are. So hopefully from this, we'll get some other clarification in the way that we do business. So hopefully that happens. And Angelica, where are you? You said that you're open. Where is your practice? And hopefully you guys know I just put a poll in the Facebook group that basically says, are you open or not, or deciding whether you're going to do that. So if you go over there and you guys can hit that poll. The PTC asked me to put that in to the group today. I think they want to get an idea of what's happening out there with us. So give an idea of what's going on. We're going to a modified schedule in Connecticut. Connecticut, I've got a day schedule. Oh, Maine, sorry, Sarah, Maine Dental Association, MDA, Maine, okay. So yeah, things are just getting crazy, especially, when you think about Connecticut, you think about what's happening in New York State. It's pushing over. And Angelica, we're okay in Los Angeles, LA County, hoping our downtime for Eaglesoft training, and we'll recommend a consolidated schedule, maybe open 2 days for emergencies. Yeah, I think, and that's one of the big things. I think this is a great opportunity to be available for emergencies. At the same time, dig in and learn more about what you can do better. Utilize this time to learn Eaglesoft. In my seminars, I talk about the fact that Starbucks lost $135 million in one day in order to train their employees how to pull an espresso. So the the story there is sometimes you've got to take the loss in order to get up to speed on some of these things. So now's the time to do all that stuff. My office is a mess back there because I'm going through the process of turning my office into a studio so I can do more webinars, more YouTube channels, YouTube videos. My oldest son, his primary source of income, and he does very well, is his YouTube channel. So I had him come over and help me with setting up some stuff to do some more YouTube videos so that I can be on the road less. Last year I was on a plane about 250,000 miles. And I have a feeling that this next year will be about the same, but I'm going to try to do some more videos and we'll see what happens with that. So Gregory said, open in Wisconsin today. Dennis said, no matter what, we will not close. Staff is concerned and upset. 50% of our patients canceled today. He has advised hygienists not to use the Cavitron. Yep, and that's what I was saying about aerosols and Cavitrons. Phil hygienist said she could not do her job well if she didn't use it. Yeah, what a nightmare. And again, this goes back to, I use the comparison of the offices that I work with. I have a huge office in downtown Philadelphia that is a federally qualified healthcare center. And the way that I see their personal protective equipment, and specifically face shields, as opposed to just a mask, could make all the difference in the world when we're talking about this. And yeah, it's not necessarily what we do on a daily basis, but this is going to be a learning exercise, and we'll see. All right. So from Sarah, is there any way in Eaglesoft anyone can send a custom message to their client? Yeah, there's a few different ways, but I'd say 80% of the people who are in this Facebook group use Revenue Well, Lighthouse, something like that. I wish they wouldn't use Lighthouse and Solution Reach, but they do. So, but if they do, then more than likely to come up with a system in Eaglesoft would kind of be for the 20%ers. But if somebody is interested in doing that, I can. That's a great post that we can put out there for people who are using that, who can use In Contact and send a message to those people. Who don't have a electronic format that they can send out a reminder. But custom messages, I think most people, and just going by what I see on Facebook, I think I must have 1,000 dental offices who I follow on Facebook, and just to see the things that they've already posted on Facebook. Somehow or another, I'm on a lot of people's email strings for their offices. So I get a ton of emails, or I've gotten a ton of emails where they're showing policy statements and things like that. And that's great. So I think a lot of offices are getting their messages out there. Open in Southern Maryland, great, Lisa, glad to see that. I'm glad you posted in here. Make sure you guys are going over to the poll that I just put into the group. So far, it looks like, and I'm refreshing here to see how many people have done it. Let's see, poll, where's the poll? It looks like most people, 43 are yeses, 5 no's, and 5 who are deciding as we speak. So obviously, most people are open. And again, I wanted to split that poll. I'm going to redo it later on today. So it says, yes, we're open, but we're open for administrative stuff. And yes, we're seeing patients. I think that I should have clarified that a little bit better. Amanda, Diana, Samantha, Samira, I'm glad you guys are in the group. Good to see you. And let's see. I was just talking earlier to Courtney in Alabama. So how are you guys in Alabama doing? That's my other home. So I was wondering, so it's funny, all of my hometown people are in here. So my Alabama and Maryland are all in here. Oh, good. So Diana thank you, Diana, put a post here for doing custom email messages. She put a link to the FAQ. So Sarah, there's your answer. It's right there. There's an FAQ for how to send custom messages if you're going to send something outside of your third-party software like Revenue Well, Solution Reach, et cetera, et cetera. MDA have just updated, recommended closing for 14 days except for emergencies. Yeah, I think you're going to see this happen all day long, where the state dental associations are going to start posting that. It is the recommendation from the CDC. I read that earlier today, and I think you're going to see everybody coming up with this closed. I think a lot of that, sorry to say, is CYA. I think they are covering their rear ends just to say that we recommended that you guys are closed, because if the problem spreads, then they can always say, well, we told all the offices to be closed. That being said, history is a big part of this. And I think if we go back to look at some of the things that we put in place during 9/11 in order to be remotely working from your businesses, the things that we put in place when the original outbreak of HIV and AIDS became part of the practices, and we start putting universal precautions, now we call it standard precautions, but the things that we put in place back then have rolled forward to where we are today. I think those are the kind of things that we should be working on right now, is working on policies and practices. If anybody has ever seen me speak, you guys know that I talk about people, processes, profitability, and philosophy. So your philosophy for your practice is driving, are you closed today? Are you doing certain things today? What are you doing? It leads you to those processes. And looking at profitability, can we give up profitability in order to, for the greater good of things? So I think this is the time that we need to look back at the basics and work on these things. We are open in Augusta, Georgia. So there you go. And I think, again, we're going to see that state by state, it's going to roll as we see the clock tick, who's going to be closed. And if you are closed, was that a choice made by the owner of the business, or was that a choice that was made by the state to be closed? And again, I think when you get a directive like what Rosie said was happening in the Maine Dental Association, and it's a recommendation to be closed. Are they actually going to say be closed? In my town, in Philadelphia, if anybody doesn't know this, the largest indoor mall, now you can look at Mall of America, the largest real indoor mall is in Pennsylvania. It's King of Prussia Mall and Plaza. The governor said that all non-essential retail should be closed, but the King of Prussia Mall is still open because they felt that they didn't qualify as non-essential. So, but if there's an outbreak there, heck, the governor could say, they could imagine if there's some legal action that can happen. Remember, we live in the United States where everybody wants to sue for everything else. So just think about that when it comes to, is it mandated or recommendation? Of course, our doctor will see emergencies, but we are taking social distance seriously. Stay home and isolate it. Yeah, Barb, I agree. Staying home is the way to go. That's why you see me in my home office doing this today, as opposed to being on a plane, which is about 80% of my life is being on a plane someplace. So is there a report that can be run that removes any account that were sent to collections that were not written off in the system? It's a great question, Sarah. Thank you for the Eaglesoft question. Great question. Depends on how it was written off. If it was written off as a bad debt, then yes, there's a report. If it was written off as just an account adjustment, that could be harder to find. So that's one of those questions where it depends on how the office wrote off that bad debt. Again, this is what I just talked about a couple minutes ago when it came back to processes. And you guys see me all the time talking about processes in the way that I set up this Facebook group. If you follow a very clear process, then yes, you could run a report in 2 seconds and find all those reports as you wrote it, all the accounts that were written off based on a bad debt write-off. Now, if you nickeled and dimed and you did a bunch of adjustments, then you might not be able to find that. It might take you 12 steps to find it. So the answer to your question, Sarah, is it depends on how it was written off. So Dave Rice, good to see you. Aaron, good to see you. Nikki, Angie, good to see you guys. Welcome. Any questions you guys have, throw them out there. And just so you know, those who came later, I put a poll in the Facebook group. For the moment, it is what it is, and you guys can answer the question. The question is, are you open, yes or no, or deciding what you're going to do? I'd like to see those numbers. I'm going to redo that post later today to ask if you're open for emergencies, open just to do administrative work, and I'll try to clarify some of the questions. I mean, some of the answers that we get in that poll. But the PTC asked if I would post that poll in there, and now it is there. So let's see. And so far it's 48, 49, 51 people said yes. 6 said they're deciding, and just 5 are closed. So it looks like the majority of people are open today, and I guess we'll see what happens. Nope, I'm not watching your Facebook Live. Somebody else is sending me a Facebook Live notice, but I can't watch that and do this at the same time. Let's see what else we got here. Checking. It's amazing how many people send me questions through Instagram. I'm hardly ever there. Let's see. Oh, question. So Sarah said, would I consider doing the Patterson event that we had scheduled, do it remotely? Of course. Yeah, and so we had an event scheduled for Portland, Maine in a couple weeks, and we had to postpone it. I'm not going to say cancel. We had to postpone it. The question is, would I do that event remotely? Yes, I'm actually. I did. I do a lot of ADOM chapter meetings through a Skype call or something like that. So yeah, happy to do that. Does it have the same impact? Maybe not. It's the difference between buying an album and going to see somebody live. I mean, I'm not that kind of person, but you know what I mean. But yeah, happy to do it. If we could do it, we can set up a remote session like that. So happy to do that, Sarah. Get in touch. We'll work that out. I heard Wisconsin Dental Association will be making an announcement later today. We are open for business as usual in Southwest Wisconsin. Yeah, Angie, I think, again, this is one of those things where everybody's kind of waiting for somebody else to make that announcement. The politician who tells everybody that it's mandatory that they shut down will be a politician who will have a hard time getting reelected. That's the nature of the way we live today. But I think this is one of those situations where the field that we're in, you're going to see, I don't know. Here's a good question. Raise your hand if you've had a hard time in the last week getting gloves, getting masks, those kind of things. Forget toilet paper. But just let's say gloves and masks. Just put a yes gloves, yes mask in the comments screen if you've had a hard time getting those things. And if that's the case, you can't get gloves, you can't get masks. How are you treating patients? Except for my buddy in Georgia, who I know probably has a warehouse full of gloves and masks. But I really like to know if you guys are having a hard time getting supplies, and if so, is that what's leading you to shut down? So again, that goes back to my yes, no. Are you open or closed? Wonder if the reason that you're open and or closed is because you can't get supplies. Yeah. And Barb said, yeah, both not available. You can't get gloves, can't get masks. The CDC is actually, I think the recommendation was for dentists not to be open. And if you look through the bullet points that they listed, one of the things was don't be open because you're taking away supplies from hospitals and first line workers. So I have patients calling to get in not only emergencies but also electric treatment and hygiene. Yeah, and Angie, that's one of those things where this is a hard call. There's so many people out there, and it's amazing. I still have people today who are telling me, this is just a hoax. This is something that China created to get rid of the population. I can't believe some of the things that I've seen posted. So yeah, but patients, if as far as they're concerned, their priority is their priority, and they're going to come in whenever they come in, and hopefully they come in with the same kind of zeal after this is all done. Yes, gloves are hard to get, but what you have a back stock of them, Susan. Yeah, and I think that, like I said, I know people who have tons and tons and tons of supplies. It is what it is. I was going to do some work around my house since I couldn't travel as much, but I can't really. I didn't want to do any painting or sanding if I didn't have a mask, so I decided to let that go. So. We have been ahead of ordering for the last 6 weeks. We have 8 weeks supply of masks. That's great. Be careful saying that out loud because, like I said, the CDC has been asking people to donate extra gloves and masks to hospitals and stuff. So as of today, we can get 2 boxes of level 1 mask only per week. Next week, it will be Patterson Advantage customers only. Yep, and rationing, I'm sure, is what's going to happen. And let's go back to the toilet paper analogy. Somebody did the math, and it was the smartest thing I saw. And it said that if you buy the big container, or the big box, or the big package of toilet paper from Costco, it would take you going to the bathroom 145 times per day for a month in order to utilize that full pack of Costco toilet paper. I mean, I think some people have just gotten ridiculous with what's going on out there. So, I think back and think about this. I use a food delivery service. I use HelloFresh to have my food every day, and I don't really have food around the house. I mean, I might have some cans of tuna or whatever, but I'm not panicking. But at the same time, I realize if HelloFresh can't deliver, I might not have any dinners. So it's crazy right now, but I think we're doing what we need to do in order to get through this. So let's see, check over here. People are sending me other messages about other stuff. So let's see, 1:15. If hopefully you guys know that I created a poll over in the Facebook group asking if you're open today, if you're closed today, or if you're deciding which one you're going to be doing. I think PTC is monitoring that to get an idea of how many people are in office or not. And looks like the majority of people are. Update 55, 56%, 58 people are yes, and 6 no. I'm sorry, 6 are deciding, and 5 are definitely are closed. So we'll see how that poll goes. And like I said, I'm going to redo it later on to update some information. Sarah asked a question earlier if if you guys go to my Facebook page, no, I'm sorry, my website, thecrewprocess.com/event. I think all of my events, well, all of the Patterson sponsored events that I have scheduled through May 1st have been canceled. Or postponed until further notice. So those things are all canceled. All of the other events that I have scheduled who are not Patterson sponsored, those things are rolling and canceling as we go, and looking for new dates as we go further out. Really want to follow the CDC guidelines of not having more than 50 people together. And I have an event scheduled, or had an event scheduled in Chicago this week, Friday. Was probably going to be a huge event, and just overnight we canceled that event, and we'll reschedule it later on. That was not an Eaglesoft event. That was a non-surgical perio event that I teach. I don't know if you guys know that, but I teach non-surgical perio. Crazy. Yes, I do non-surgical perio. So that event was postponed, and I think you're going to find that all these events are being rescheduled and postponed. I have, if you think I'm in I'm either on stage or in an office every Friday this year, and through May 1st, looks like all of the events are scheduled. I'm still scheduled to come out and work with some of the offices on a lot of different things. So we'll see. Let folks, tons of remote option works. Yeah, Ethan, I agree. So what we're talking about, and I said this earlier in the chat, I think remote working is one of the things that we're going to find will be a byproduct of this whole thing. I think this is an important time for offices to realize that we can work remotely. We can make a difference in what we do on on an ongoing basis by working remotely. I think this is a great opportunity to work on policies that when people realize that we didn't have policies in place, this is a great opportunity to work on those policies, get some things in place. You may not be making any production, but you're making productivity as we go. So sometimes you need to, I have all these stupid phrases that I use all the time, but it's the truth. Sometimes you need to slow down to see the crowns. Sometimes you need to take a really long exam so that you build a greater treatment plan. Sometimes you need to close the practice in order to get things better with what you do. So yeah, Microsoft Teams, Zoom, Google Tools, I agree, Ethan, this is the time to do it. And yeah, and Ethan, ask your IT folks to set that up. And you missed it earlier. One of the questions, Ethan, that came in earlier was about doing the upgrade to Windows 10 and Eaglesoft 21. And I think that's a great idea if you check with your IT company to make sure that they're up to full speed and able to help you with those processes. But don't do it yourself just because you're sitting around the office with nothing else to do. Now is not the time to do an upgrade if you don't know what you're doing. So. And let's see who else joined the group that I can say hi to. Tia, Kay, Heather. Hey, Amy, how are you? So let's see. Question. We are closed for 2 weeks. Pedo office in North Carolina. Let's see. High Point. All right. Nope, don't know that pedo practice. But yeah, I think what we're going to do is you're going to see, especially in pedo. I have one of my good friends who has a husband and wife team. Husband's an orthodontist, and wife is a pedodontist, and they closed down both of their offices. And the notice that they sent out to the patients was just gut wrenching because of the number of people who they're basically having to lay off. I mean, for the time being, and both are fairly new practices, so they're at that point where they need to, financially be available. Yeah, definitely upgrade to Windows 10. Yeah. Okay, Ethan. Yeah, upgrade to Windows 10. They should have been on Windows 10 already, but they need to make sure that their IT folks can help them with that process. And if you guys scroll back up through the comments, Diana from the PTC posted a link in response to a question from Sarah for if you guys want to do a custom email campaign to send out messages to your patients, if you are not using something like Revenue Well, Solution Reach, or Lighthouse, if you're not using a third-party software, or if you just want to do it on your own and you want to create something that's bigger than well, no, either way, it would be an email campaign. So there is a FAQ link that Diana from the PTC put into the thread. So if you scroll up through the comments, you'll see her post. So that's in there too. And I just love the fact that we have this as the option to be able to talk about it. I'd rather that we have one or two single posts than what I see on Facebook with 1,000 different posts with misinformation and bad information out there. So, and actually, I'll use this moment to talk about the fact that I'm getting, well, not getting. So I've gotten a few hate emails for the fact that I keep moving questions around the Facebook group, and my response is tough. I hate seeing the same question posted a million times. I'd rather see one of the questions being posted in a very clean format so that the answers to the questions are grouped together. In the same way, I can't stand seeing groups where, somebody will ask a question and then the only thing you see for the next 4 hours is following. Who cares that you're following it? You just say you want to be notified and you'll see the answers come up. So, but I'm getting hate mail about that. So, hey, I can live with it. So anyway, let's see. I am checking my other social media to see what other people have been posting. Yep. Now, yeah, if you guys are bored, today is my son's birthday, and he's a YouTuber. He has a really fun YouTube channel, and I'm getting, that's the other thing, I'm getting bombarded with posts with messages from people saying happy birthday to him because I said happy birthday to him. I just put a link in the Facebook, in the chat for his YouTube channel. So go watch that and give him some happy birthday love. Let's see what else we have here. Oh, yeah. I said this in my post, my first post about what we're going through with the coronavirus, that this is an opportunity to really expand what you guys are doing. So this is a great opportunity to schedule some time to go through some of the, if you go to the live webinars on the FAQ site for the PTC, there's some great time. This is a great time to watch some of those videos to learn some content. I'm going to put another link in the chat. Where is it? For continued ed. This is one of my favorite links in the entire group for where you can find videos, where you can find, if you're new to Eaglesoft, where you can find some resources there. It's a great sort of precursor for anybody who's just gotten into Eaglesoft, what they should do and where they should go. And hopefully you guys will hit that link to find out some more things that you can do. This is a great time to kind of sharpen the sword, learn some more things about utilizing Eaglesoft. And for me, it's getting out of bad habits. That's 90% of the learning in Eaglesoft is getting out of bad habits. So this is a great opportunity to take some time to learn that. Kelly, I appreciate that. I am fairly new to Eaglesoft. Great. And hopefully you got into, clicked on that link and learned some more stuff and sharpened the sword. The great thing about the way that this group is set up is, you can get an idea what everybody does, and you can start to see patterns of questions where people have done things the wrong way, and now they're suffering the consequences of, creating third, fourth, five versions of the same patient. So get in there and utilize the tools that are out there. While I have a bunch of you folks here, so there's 29 people in the chat at the moment. So one of the things that I will tell you is be very careful. I just had to deal with this last week. Be very careful of people who are teaching or who are saying that they are Eaglesoft trainers. I worked with an office last week who had somebody come in and train them on Eaglesoft, and I've had to go and fix a bunch of things that they were told to dump support by this person, and they were told that they could train them, quote unquote, train them, and the things that were done in the as part of the training. I wish that the person could be sued for malpractice, because it's horrible. And like I said, the person had already dumped, they'd stopped their support and hired somebody to train them. So be very wary of people who are saying that they're trainers. I am not a trainer. I am not certified as a trainer, and I make sure that everybody knows that. What I do is, I can help you get more out of Eaglesoft, but I can't train you. And that's why you're going to see lots and lots and lots of posts in the Facebook group about, if you need somebody, these are the people to call. And, if you have a question, call the PTC, call your IT company. That's what this group is all about, is helping you find the right answers. But be very leery. So Mike, hey, how's things in Delaware? Good to see you in the group. And any questions you guys have, please throw them out there. Let's see. I'm checking, believe it or not, I'm checking Eaglesoft, Facebook, Messenger, Instagram, and let's see. Oh, there it is. Somebody just sent me another message. No, I'm not going to answer that out loud. But yeah, somebody sent me a message about this, about what I was just talking about with sort of the rogue trainers. So I'll address that later on. Anything else that you guys are running into? Anything else that I can help with? There's an ongoing thread where I posted that I was going to be doing this Facebook Live with questions about if you're moving patients around your schedule, what should you do and how should you be, where you should be holding patients. If you use RevenueWell, you could set up a column that RevenueWell will not confirm those patients. So you can move patients into that column and set it up that way so that you can keep them on the schedule. So if you have to reschedule them, there are some tools, and I'll do some screenshots once we get off of this live, so that if you have to move an entire day, you can do that. You can do a mass update and move patients from one day to another. So there's ways of doing that, but be aware, if you're going to have to make some sort of, actually, you might as well do it now. Create yourself an auto note that is a patient move based on the guidelines or recommendations from your local dental society, local dental association. So you might as well create yourself an auto note so you don't have to retype that over and over again. So hopefully you guys will do that. And let's see, I see a question. Somebody sent me a private message, but private, not to read to you guys. But anyway, anything else that you guys have, let me know. Happy to help. And just, FYI, so you guys know, your local TA are their local certified technology advisors. A lot of them are in the Facebook group. People who've been my friends for 20 years plus are in this group watching what's happening, and make sure you're posting some things about what's happening in your practice and how they might be able to help you. The PTC is here and watching and helping, and I try to stay in touch with as many people at the PTC as I can to be able to sort of help and guide some of you guys in some of the issues that we have. So let me know if there's anything I can help with. You got people in the group like Ethan, who was just commenting about doing upgrades, who are IT experts who can help you through some of the things that we're going through. And especially, like he said, working on some things like remote access to the computers. So if we're not able to work in the offices, we can work in the offices. Some of the people who are in the group who do outside, let's just call it virtual assisting for anything else, for better virtual admin stuff, who are doing insurance processing and insurance verification, things like that, who are in the group. They're here to help. Ask your questions away, and we'll be able to make sure those things come up. Let's see. Avenel, how's things going in Jersey? Let's see. I see lots of my real life friends and lots of my virtual friends in the group. So if you guys have questions, please let me know what's happening with you guys and how we can help in the field guide. And remember, most of I'd say the things that you post in the field guide are also being monitored by the PTC, so that if they see patterns and things like that, that they can jump in and help too. Please let me know how we can all help with those things too. So, and I'll paraphrase a question that came in from a private message. Yes, I know I've had to reschedule some things. So Portland, Maine is being rescheduled. Houston's being rescheduled, and maybe we can do some of these as a virtual meeting, but it's not the same thing. A virtual meeting is not the same thing as a live meeting. But we'll, my original posting about travel being changed is, I think I will do some more of these Facebook Live meetings and try to do some other stuff, but I'm not great about talking directly to a camera, so you gotta bear with me. I like doing this live. I like interacting with people, so I'm going to try to do a little bit more of the Facebook Live stuff and answer your questions. But I think the field guide is, without me being live on a video camera, I'm always live, meaning your questions come in and I see them. Believe me, my phone dings 24 hours a day with questions that come in. I think I answer as quickly as I can any questions that come in, except when I'm sleeping. But I'm a vampire, so I only sleep a couple hours a day. So, but questions that come in, I will answer them as soon as they come in. Believe me, I'm fielding them all. Not sure if I've already discussed, but seen a few other dental law forums that there's lots of insurance companies that are closing. Yes, insurance companies that are closing. But remember, insurance companies, for the most part, are automated. I think where you're going to see the slowdown is if there are attachments, those attachments will not be processed. If they're closing, like Delta Dental was one of the ones that posted something that, yeah, somebody asked a question about that, not necessarily in the chat today, Rochelle, but in the Facebook group about Delta Dental and processing, but they were sending paper claims. And I wish, let me see, I don't know if I can post in here. No, I can't. I'm going to post it in the Facebook group. I get to travel to an insurance company, and without disclosing who the insurance company is, I live in Pennsylvania, and it's a big insurance company in Pennsylvania. Hint, hint. So I get to travel to an insurance company in Pennsylvania on a regular basis, and they get a room full of paper claims every day. A room full of paper claims every day. So if you imagine those little plastic cartons that the mailman will drop off if you haven't been to the post office in a long time. So if you imagine those, imagine a room full of those plastic mail holders. They get one of those. They get a room full of those almost every day. And the crazy thing is, we shouldn't be sending paper claims. We should be using electronic attachments. If using NEA through Renaissance Remote Light or through using Patterson's electronic claim service, either way, you should be sending paper claims. So yeah, there's a question right there. Is it better to send electronic or paper claims right now? Electronic claims. But even if you send an electronic claim, if you're asking for an advisor to review that claim, if they are closing down their offices, there's nobody who can see that claim. What I would tell you is, for the time being, if you've got a crown to submit that you've already done endo on that tooth, then just send the electronic claim. Send the electronic claim, and they already have on file that the tooth, if it's within a short period of time. If you send the claim in for the crown that already had the endo on it, they've already got the endo on file, and they may just automatically process your claim. So we might use this opportunity to get through some of this stuff, and hopefully some of the experts who are in the group, like Teresa Duncan and Tom Lamoli, some of those folks can chime in on some of the process, and I'll tag them in some of those posts about Delta, see if they can chime in on that stuff. Let's see. Most of the insurance companies are moving for work from home. I have a few clients of large insurance companies. They're fast tracking policy. Yep. Yeah, and I agree. Yeah, I think you're going to see that everybody is going towards working from home. But that doesn't mean that they can't see your electronic, because remember, with NEA Fast Attach, it's not like you're attaching an X-ray to a claim and then that X-ray gets gets sent to the insurance company. What happens is the insurance company goes out to the NEA server to look at that X-ray. So it's not a physical submission. It's not like the X-ray is being sent to Delta Dental. It's being, what happens is there's a chime that goes off and says there's an electronic attachment. Would you like to see it? And then the advisor goes to the NEA server to look at that image. So don't worry about that. So yes, everybody should be sending electronic. Do not send paper claims, period. Let me see if I can get this to post over here. Stickers. It doesn't look like I can post pictures in this chat. So I guess I'll have to do it over here. So I just pulled up these pictures, and I was just adding them to the presentation I'm doing on Friday. And let's just see if I can. Nope, it doesn't look like I can do it without doing a bunch of other stuff here. So, but I will post those pictures that I took when I recently visited an insurance company. I think you guys will be amazed at how many paper claims are still submitted. Let's see if I have it here. I'm multitasking. Give me a second. Let's see. So I just posted a link. Take a look at that link, and you guys can see how many paper claims come in and how ridiculous it is that people are still sending paper claims. Might as well be writing your claims on with crayons or something. I don't know. So let's see. 3 questions posted. I'm just checking. I told you I'm checking all my other social media while we're talking. Oh, I know that person. So let me. What did we do before social media? Golly. Give me a second, guys. I have to make sure I do something. There you go. Had to approve somebody getting in the group. I'm doing 10 things at once. So questions did you guys have? Not all smaller carriers accept electronic claims from all clearinghouses. I call Renaissance sends paper claims when you, yes, you're right. So Ethan said that not all carriers accept electronic claims. Yes, you're right. But remember, this is the deal. If there is, and I maybe somebody can do it, so I don't have to do it here, but if you go to the Eaglesoft FAQ and you look at, you type in a search for, not payer ID, and I can't think of it off the top of my head, but there's another ID for the attachments. You can get a list of all those companies who do not accept electronic attachments. So, but that's a good point. But if you're not sending electronic attachments, you should be. And let's see. I'm checking. There's way too much social media. I think we should stop. I think everybody who, if you've got a TikTok or a Twitter or something like that account, everybody needs to shut those down. We just go to one source. Sorry, I'm being a grumpy old man at the moment. Anything else that you guys can think of? I'm going to see how long before I run out of time here. Probably got 15 minutes, and then I'll shut this down. But any questions that you guys have, anything that I can help with? And yes, the answer to about 50% of the questions that are going to come up is contact a PTC. So, you know, that's my fallback on a lot of things, because sometimes it's above and beyond what we should be asking here in the group. But beyond that, let's see if there's anything that we can take off of their plate so that they can keep the ball moving forward. And I'm going to review. Wow. Okay. So here's the poll so far. So I asked everybody if they would go out and check the polls to see how many people are open, how many are closed, and how many are deciding. So far, 75 are open, 10 are closed, and 5 are deciding. So there's your stats. Who's closed to? Oh, thank you, Diana, for the NEA payer ID. That's what I was looking for. God, I love having people here. Okay, MySpace. Yeah, that's it, Ethan. We'll all go back to MySpace. So, yeah, it's like a single payer. We all need to be on one platform. That's our social media platform, MySpace. I'm there. You start printing the signs, and I'll carry it around. We'll put them on little Andres to go around the country. You know, MySpace is the only social media we should be using, and both of us will get laughed out of society. So, any other questions that you guys have? Where's the poll? Okay, so I'm going to put a link. Maybe I can't. All right, let's see here. I can't make a link. because I turned off the commenting. Let me see if I turn the commenting back on. Turn on commenting. Nope. Now I can do it. Copy link. Turn off commenting. Boom. There is the poll. Okay. Our office is closed. I'm going to work outside. Outstanding claims. Any other ideas of things to do? Yes. And that is exactly what I was saying that we should be doing, is utilizing this opportunity to do some admin work. If you guys are going to, if you are closed today, this is the perfect opportunity to learn more about how to use the software. I posted a link. If you scroll back through the timeline of this chat, you're going to see some learning opportunities with webinars and things from the PTC. So what else would I do as far as outstanding claims? This is a great opportunity, if nobody else is in Eaglesoft, to do some cleanup. This is a great opportunity to get rid of some of the duplicate employers, duplicate insurance companies, and there's a bunch of links in that same post about how to get rid of duplicate employers, get rid of duplicate insurance companies, clean up your claim payer ID numbers. I mean, unless you're using Renaissance, which they don't really care. But if you're submitting your claims through who I recommend, which is the PTC. So if you're submitting claims through PTC and your claim payer IDs are incorrect, this is the day to do it. Get those things cleaned up so that your claims are going through properly and fast. So take the time to do that. Outstanding claims, great thing to do. I do that, don't worry about printing a report. Just sort them by the outstanding date and work them that way. The problem with working on outstanding claims today is you're going to have a lot of insurance companies who the wait time is going to be ridiculous. So one of the things I suggest is just resubmit the claim. The minute a claim gets to 45 days in my office, it gets resubmitted. Because guess what? I'd rather spend the extra 45 cents to resubmit the claim than it would be for me to actually get on the phone and call the insurance company. So unless you have somebody else who's doing it, that's why I spend time with some of the e-service providers. I don't know what they're calling themselves nowadays, but like e-assist, the practice mechanic, my good friend Rick at the practice mechanic, if you're using services like that, this is the time to get with those guys to help you with the outstanding claims. And if you get things cleaned up on your end, then you can get somebody to help you on the outside to help you with getting that money in. Let's see. So Northeast Wisconsin, yeah. So yeah, and what's happening out there? Great day for creating draw types. Yes, right. It's that's my the way that I doodle is to work on draw types and to help get better with utilizing charting. So yeah, today is the day to work on that and get some of those things cleaned up so that we can, the great thing is this is the time when, if you start looking back through your charts, if you start to use Money Finder, that when you decide to go back to work, to start seeing patients clinically, then this is a great opportunity to know what's out there, what's in your charts. Use Money Finder to find out how many people had a root canal but never had a crown. Look for those kids who they are between 7 and 14 years old. They have insurance, but you haven't done sealants. So this is a great opportunity to be able to do some of those things. If a patient has dual insurance and we are trying to figure out the account balance, do we go by the primary or secondary contracted fee? What a question. So there is, I think, 3 posts out there about how that works. So really what has to happen is it goes by the lower of the 2. Well, actually, it depends, because there's 3 different types of coordination of benefits. So it really depends. And there's a bunch of discussion there. I think it's better that you read through those, because it also depends on the contract you have with your providers. There's a lot of different things out there. So I would direct you to those posts. If you type in coordination of benefits, I think you're going to find the answers to that question. All right. Do you know how Renaissance gets the claim to the insurance company? What the actual physical mechanism to do that? So I can only speak to what I I honestly, I can say I don't know how they actually do that. At one time, they were faxing claims. It was almost like an electronic transmission of a. That's why I'm going to tell you what I was told. That res print is almost like a e-fax, where that information is transferred almost not electronically, as in ones, zeros, but as a electronic fax. And that claim is almost like a paper claim that goes to the insurance company. So I'm not 100% sure, and I'm sure things have changed. But the other thing is Renaissance has changed a lot in the time that I've been doing this. So I couldn't tell you exactly how it happens, but it's magic. It just happens. And they only charge you whatever, $49 a month. So whatever the magic is, you just don't want to look behind the curtain. Just let the money go. Is there a report that shows which inactive patients still have insurance hooked up to them? I've been removing insurances and find them to inactivate. Okay. If you look in the post about Ethan's answer to that, how does Renaissance send the claim? He says it depends on the carrier. Agreed. Okay. So is there a report for patients who are insurance companies with patients attached to it? You can run, and I'm sure there's a post about this already. You can run a report that is employers, hold on. It's patients by employer or patients by insurance company. So you can run that. You can pick the insurance company, and this is going to be a one by one thing. So you can go in and say, show me all the people who have Delta Dental of X. Run that report, and then you can then use that to clear up those patients before you try to inactivate them. It's a pain. This is also the opportunity to start a process that says, as we inactivate people, we make sure we take their insurance off. So again, that I'd say in the first year of doing this, and this is year 4 of the field guide. Yeah, it will be going into year 4 of the field guide. The first, I think, 100 posts that I put in this group were processes so we don't have to worry about this in the future. If we inactivate patients properly, we don't have to worry about patients being attached to inactive insurance companies or inactive employers. So Blue Cross Blue Shield of North Carolina is through a X500 connection. All right, IT guy. I don't know what an X500 connection is. I love teasing people. Thank you, Ethan. Now I got it. Okay. That's how I'm doing it now. It's slow going. Yes. So Barb, it's the same thing. The worst part about bad information going into Eaglesoft is the long, slow process to get you out of that bad information. I said it a little while ago, but I'm going to say it again because there's more people in the group now. I was working with an office last week because they dropped their support with Patterson, and they had somebody come in to quote unquote train them and screwed up a bunch of things in the office. And to get them back to where they needed to be, it is a slow process. And the only answer I had for them was, you've got to fix every single thing that was done incorrectly, and a lot was done incorrectly. So they're having to clean up. So it is what it is. Hey, Joanna. Yep. So there's a lot of stuff that we talk about, and you guys see me all the time talking about. You need to get a certified Patterson technology advisor in your office to help you, and this is the opportunity, and that's why I posted that link above. This is the time to be able to go back and to make sure that you're doing things properly, to make sure that you're scheduling properly, so that we can reschedule properly. We're going to have a lot of data that is going to be a weird blip. So anybody who's using Dental Intel, when they look in the future at March of 2020, and there's this blip in your production and collection number, are you going to be able to say that is because X, Y, and Z? I mean, if you're an investor and you automatically know the stock market crashed in 1929, the stock market crashed in 2008. If you know these things, that when you're looking at these graphs, you know why that dip is there. So remember, this is one of those things that we're going to have this blip in our Dental Intel numbers to be able to say, this is why numbers were wrong. So that when you have I'm saying if this month you do $100,000 and then your norm is 150,000. When we get to March of 2021, you're not saying, wow, we did so much better than we did last year. Well, last year was the year of Corona. So we got to look at it in a different way. Hey, Terry, how are you? One thing, and I'm gonna gush for a minute. I just love the folks that are in this group. I mean, every time I get to hang out with people, I get to, it's great having you guys as digital friends. But when I get to actually hang out, like I got to hang out with Ethan, in Charlotte before I had to go catch a plane. I get to see these folks. I get to have tacos with Joanna. This is what makes this group so great. I mean, because we're not only helping each other from a technology standpoint with the software, but I get to hang out with you guys and be friends with you guys. That just makes all the difference in the world. I do exactly what my mother told me never to do, is meet people online and then go hang out with them in public. So it's been a blessing. So let me see, 2 other things that came in over here, and I'm going to double check what these questions are. Let's see. Everybody's commenting on my post about if life gives you lemons, you make lemonade. Let's see. Oops. For inactive patients with insurance, attach run master report, filter the correct. Okay, good. So there is the answer to your question, Barb. Diana posted down there, so you can filter master report to inactive with insurance status with insurance. Yes, but the problem is you could have, yeah, okay, good. All right, so if you inactivated somebody and their insurance status is with insurance, perfect. That's a great report. Thank you. There's a good work, a good quick way to find that. Yep. Thank you, Diana. That's perfect. That's exactly what Barb was looking for. So Barb, hopefully you saw that. I'm gonna just reply. Nope, I can't do it that way. So hopefully Barb is still watching, but if not, I know how to get to it. Oh, she said thank you. So she watched it. She saw it. What's this? Oh yeah. Yeah. So yeah, it transferred from Barb's information transferred when they did a conversion from PracticeWorks. So yeah, and again, the same thing I was saying, it's just slow going, cleaning up stuff that came over that way. And especially when you have a conversion, it really is just cleaning out the junk that came over from old software, especially when you're talking about something like PracticeWorks or SoftDent, who saw insurance completely different than the way Eaglesoft sees it. So where do you click the insurance status? So it's either with insurance or without insurance. So insurance status would be somebody with insurance or without insurance. So they either attach to an employer or not. So, and if you go to the patient master report, so if you go to reports, and sorry, I can't do screenshots during this. I wish I could even share my screen with you, but there is a patient master. I'm going to do it so I can see it. And insurance status is about 3/4 of the way down on the left column. And there's a drop-down choice, one's with no insurance, with insurance, or with primary and secondary insurance. So if you go to patient master, go to the filter, look midway down, left column, you'll see insurance status, and that's where you can change that status. Got it? Good. Thank you. And let's see what else came in over here. Oh, somebody sent me a text. Oh, nope. Private message. Yeah. All right. So it's 2 o'clock. I'm going to get ready to shut this down. So if you have any other questions, you got 2 minutes to send it to me. Otherwise, I'm going to get out of here and go back to actually doing the work that I'm supposed to be doing today. I've got, believe it or not, plane tickets that I've got to reschedule because, like I said, I was supposed to be going to Chicago this Friday to do a presentation. That's got rescheduled. Okay, what was the question? What is the best way to get recall with no appointments scheduled? So we can, okay, so you're saying patients who are due but don't have scheduled appointments. So a lot of different ways. And actually, there is I can probably throw the link in there. But there is a recall. There's an entire page set up for recall. And I want to give you the caveat, first, do you use a third-party confirmation software? If you do, you want to make sure you're not stepping on the toes of that software and sending people to that. But I just put a link there, so you can see the some of the discussion about how to do that. But I can see right there, there's a couple different ways how to do patients who are due but don't have scheduled appointments. So there's a couple different ways. To hit that link below, you'll see it. Barb, thank you. I can't wait to get back to Michigan to come visit you guys. And let's see. All right, so I'm going to shut this down. And if you guys have any other questions, make sure you're posting them on the Facebook group. I'll answer them there. We will do some more. And I think we'll make it through this process. I think, like I said, I'm going to update the poll. Everybody go over to the Facebook group and click on the poll. Are you open? Are you not open? And then I'm going to probably at 3 o'clock redo the poll and see, put some more nuances in there as far as, are you open seeing patients, open for admin, closed for mandatory reasons, meaning the state said to be closed, or closed because of choices. So I'm going to update that information, and you guys let me know what's going on in your part of the world. Sorry, I won't be able to see you guys in Houston. That's been rescheduled. In Maine, that's been rescheduled. In Chicago, that's been rescheduled. And a bunch of other events across the country. It's rolling every day where these things are being rescheduled or canceled. They really should. I love you, but I'm not giving hugs right now, and hopefully we'll get through this real soon. So thanks, everybody. Give me a shout out in the Facebook group if you have any questions or if there's anything else that we can help with. Take the time to go through the links that we posted here. PTC posted some great links. I posted a link for, if you're new to the group, what you should be doing and how you can find some great webinars and things that you should be looking at. This is a great opportunity to look at your schedule and find some time when you can bring in a technology advisor to do some hands-on training in the office. So take the time to really dig deep and work on your practice. If you're not working in your practice right now, this is the perfect time to do that. Take the time to sharpen your sword. Please come to Los Angeles after this crazy time. Hey, if anytime I get an opportunity to fly west, I'm doing it, and get a chance to see my family in the Pomona, Pasadena area. So get to go into the LA area as often as possible. So happy to come out to the West Coast. So questions, make sure you're posting them in the Facebook group, and I will talk to you soon. Be safe out there, and thanks for being part of the field guide. Thanks.